This is kind of a follow-up to my last video regarding medical marijuana, and I've been told that I came off a little bit harsh. I spent a lot of my adult years trying to make it famous as a professional wrestler, and while I never made it famous, I sure had a fun time trying. And I was told that a lot of what I said came off as like I was trying to still be that professional wrestler. So when it comes down to what I'm going to say now, I'm going to be as calm as I possibly can. But just know that I have a lot of emotion involved in this. Mr. Attorney General Jeff Sessions has decided he's going to go against all of the states that has pretty much decided to get with the times and legalize marijuana for medical, recreational, and whatever. I remember I used to scoff at the idea of medical marijuana because I thought of it as a cop-out. And there was a time, a couple years ago, I was at a wedding in Alabama for some lifelong friends who were getting married, and my knees were just absolutely killing me. And when I say killing me, I mean this was a night ender. This was something that was painful enough where I was ready to just go back, take my wife, go back to the cabin, and just say to hell with it. Until a friend of mine offered up marijuana, and I admitted I tried it. Within maybe 5 minutes, that pain was gone. Completely and totally gone. I was able to interact with friends that I've had for 25, 30 years and be just fine. But it was amazing to me because at that moment I realized that my issues with people who use marijuana and call it medical, my issues were misguided. And they were flat out stupid, to be honest with you. That was the first and only time I've tried marijuana. I wish it was legal here in North Carolina, but it isn't. So it is what it is. Now, my daughter, who was injured when she was born at Landstuhl Regional Medical Center in Germany at an army hospital, there was a midwife who was a major at the time who made some of the most blisteringly dumb mistakes you could make when delivering a child. Funny thing is, she's now a colonel. And I'm just going to leave that there where it lays. The main portion of that section of this story is the fact that you go from destroying a child's life as it's getting started to being promoted to full bird colonel. I'll never understand that until the day that I die. Now, my daughter, she cannot speak, she cannot walk, she'll never be able to take care of herself. She is pretty much for the rest of her life will be relying on the care her mom and I give her. And we do a pretty good job because when it comes down to it, I was the pessimist of the family, of the pair of us. And if my daughter was going to die, I wanted to know the most likely scenarios possible. And it was explained to me that their quality of care, or the quality of life that Samantha would have, would be completely and totally dependent upon the care that she was provided. Now, when my daughter was born, my wife had the career that got us overseas. I just had a job. I was a bowling alley manager, for goodness sakes. So it became pretty obvious once we got back to the States who would become the de facto stay-at-home parent. Me. And that sure scared the living hell out of my parents, and especially my father, because I had failed at so many things in my life that I had tried. I had failed on my own accord. cord. All the mistakes that I made were my own because I pretty much ignored everybody and every bit of advice that I was ever given. Initially, Sam was given 2 years or less to live. And we were told that her quality of life would be completely and totally dependent upon the love and care that she received by us, her family. This coming February 2nd, she's going to turn 12. She wasn't projected to live past 2. So we must be doing something right. I must have been doing something right. Now, we get to the myriad of drugs that she has had to be on for her life. And these are drugs that you, Mr. Attorney General, and the Justice Department and the FDA deem as safe. First one was something called Keppra. Now, let me go down the list of side effects of Keppra that my daughter had to put up with. And I have notes in front of me if you're wondering why I keep looking down. Aggressive or angry. Anxiety, changes in personality, chills, cough or hoarseness, crying, depersonalization, diarrhea, dry mouth, euphoria, fever, general feeling of discomfort or illness, headache, hyperventilation, irregular heartbeats, irritability, joint pain, loss of appetite, lower back pain or side pain, mental depression, muscle aches and pains, nausea, painful or difficult urination, paranoia, quick to react or overreact emotionally, rapidly changing moods, restlessness, shaking, shivering, shortness of breath, sleeplessness or unusual drowsiness, sore throat, stuffy or runny nose, sweating, trouble sleeping, unusual tiredness or weakness, and vomiting. You guys call that safe? I mean, all these side effects that I ran down, you guys at the Justice Department, the FDA, and the Mr. Attorney General, you guys call that safe? Now, when that medication quit working, she was put on something called Onfi, or better known as clobazam. Let's look at some of those side effects from drugs.com. Difficulty with swallowing, fever, shakiness and unsteady walk. Now, she can't walk, so I'm not going to hold you all responsible for that. Unsteadiness, trembling, or other problems with muscle control and coordination. Changes in speech pattern. Granted, my daughter can't speak. Restlessness, slurred speech, trouble sitting still, trouble speaking. It goes on. Agitation, black tarry stools, bleeding gums. We've had that issue. Blistering, peeling, or loosening of the skin. Now, we're currently dealing with an unknown blister that showed up on her ankle and one that showed up on her first finger, of all things. For no apparent reason whatsoever. There's the biggest blister I've ever seen on her heel. And one of the bigger blisters I've ever seen on her finger. Let's see. Bleeding gums, blistering, peeling. Oh, I already read that. Blood in the urine or stools, chest pain, chills, confusion as to time, place, or person. Cough, diarrhea, difficult or troubled breathing. As her stay-at-home dad, I can tell you there has been plenty of times where it seems like she's annoyed or angry, where she will breathe very heavily. And it never dawned on me that the medication might have been causing this. It was more towards me thinking, okay, something else is going on. I need to lay her down. Let's see. Holding false beliefs that cannot be changed by fact. irregular, fast or slow, shallow breathing, itching, joint or muscle pain, lack of feeling or emotion, painful or difficult urination, pale or blue lips, fingernails or skin, pinpoint red spots of the skin. That she's got, big time. Let's see, red skin lesions, often with a purple center. Hadn't seen that one. Red or irritated eyes, seen that one plenty of times. Seeing, hearing, or feeling things that are not there. Sore throat, sores, ulcers, white spots of the mouth or on the lips. Yeah, she's had that. Swollen glands, troubled breathing with exertion. I think I've already covered that. Unusual bleeding or bruising. Nah, we haven't really touched that one. Unusual excitement, nervousness, or restlessness. I would give anything to see my daughter get excited at anything. Unusual tiredness or weakness, bladder pain, cloudy urine, cough with mucus, frequent urge to urinate, increased appetite, lower back or side pain, double vision, full or bloated feeling, headache, muscle spasms, pressure in the stomach, rash, hives or welts, red skin, swelling of the stomach area. You guys call safe? Now, we move on to the other drug she was on at the time. Topamax. Tiredness, drowsiness, dizziness, nervousness, numbness or tingly feeling in the hands or feet. Coordination problems, diarrhea, weight loss, speech and language problems, changes in vision, sensory distortion, loss of appetite, bad taste in your mouth, confusion, slow thinking, trouble concentrating or paying attention, memory problems, and cold symptoms such as stuffy nose. There's also one more. In 5% or less of patients, kidney stones. You know what these are? There's 39 of them in here. These are kidney stones that my daughter has had to deal with as a child. This is something that you, Mr. Attorney General, Justice Department, FDA, this is something you guys call safe. I say bull to that. Okay. And let's move on down to the replacement for Topamax, which is the drug that caused this kind of hell. How would you like to, however old you are, Mr. Jeff Sessions, Attorney General, how would you like to pass 39 kidney stones in the realm of about a month? 39! Ficampa was the replacement drug. Aggression or anger, anxiety, clumsiness or unsteadiness, dry mouth, hyperventilation, irregular heartbeats, irritability, restlessness, shakiness and unsteady walk, shortness of breath, sleeplessness or unusual drowsiness. My daughter sleeps constantly. I would give anything to see her awake more than 5 minutes a freaking day. Trouble sleeping, unsteadiness, trembling, or other problems with muscle control or coordination. Changes in behavior, depression, thoughts of killing oneself. Killing oneself! That's safety, you guys? You're the federal government. You're supposed to be charged with protecting the citizens of the United States, and yet you approve drugs that say thoughts of killing oneself is normal. How in the hell is that something the FDA can approve? Now, we get to CBD oils, cannabinoid oils. We have tried, Samantha, on cannabinoid oils, and unfortunately it's gotten to the point where now her neurology department will absolutely discharge us from their practice if we even mention anything to do with cannabinoid oils or cannabis, even though cannabinoid oils here in North Carolina are completely and totally legal. You know how hard it would be to start over with another neurologist? You say that marijuana is a gateway drug. To that, sir, I say beer is a gateway drug. Beer. Tasty as can be. I've heard that cannabis, marijuana was a gateway drug as long back as I can remember, and I'm 44 years old. I think you need to find new talking points, sir. The co-pays for our daughter's medications, the co-pays alone are almost $1,000 a month. How much money does the pharmaceutical industry pour into congressional and Senate races? Let's look at big tobacco. And how many die from tobacco use per year? According to your CDC, Mr. Attorney General, 480,000. Let's look at the benzodiazepines, which are rooted in just about every single anti-seizure medication. 8,000. Mr. Attorney General, in the Justice Department, the FDA, I say your arguments are antiquated. They are tired. They are old. They are just ridiculous at this point. How many deaths have been attributed to marijuana? Well, up until recently, none. But there was one. There's one now. But if you go and look a little bit further into that situation, that one attributed marijuana death had a root heart condition that the news just didn't want to report on. The war on drugs was a great talking point back in the day. The war on a plant is absolutely ridiculous. There have been so many cases that have been documented by people who have been helped by cannabis, marijuana, whatever you want to call it. It's been proven to help people. It's been proven to help people without all these nasty side effects that I've just gone through. Your resources at the Justice Department could be used on so much more than just a freaking plant. The only thing that marijuana doesn't have is a bunch of lobbyists throwing thousands, millions, billions of dollars at politicians. That's the only thing it lacks. Otherwise, it'd be legal, just as legal as beer. Cheers. Mr. Attorney General, your legacy is at stake. Okay, right now your legacy is not the greatest that it could be. Your war on drugs, specifically marijuana, is misguided. It's old. It's tired. Everybody's sick of it. How you choose to navigate from here with your legacy, it's completely and totally up to you, sir. And as a father, that's all I can say. Thank you for listening.